Education is not the only victim of Oklahoma's budget crisis. While the state ranks second in the nation in the number of adults with serious mental illness, Oklahoma is continuing to cut mental health services. That's left many in both the public and private sector looking for other ways to provide services and trying to do more with less.
It's been a tough year for the Oklahoma Department of Mental Health and Substance Abuse Services. Even before this year's budget was finalized, revenue failures in the fiscal year that ended June 30th ripped $23 million from the agency.
In addition to that, because of our required Medicaid match and other things that we do as an agency, our just required flatline costs are actually going up $4.5 million next year. Altogether, we needed over $27 million, right around $30 million, to not have to make draconian cuts.
Commissioner Terry White says those cuts are magnified by the loss of the matching Medicaid funds.
For those Oklahomans who are on Medicaid who need mental health and substance abuse services, we provide the state match, about 35 cents, that pulls down the federal match, about 65 cents of every dollar. So when we lost those over $20 million, what that actually translated to is a loss to providers of nearly $60 million because they lost those federal matching funds as well.
The agency has seen a loss of $1.5 million in funds targeted for expansion of mental health courts, $1.3 million in cuts to safety net services, $7 million in cuts to community-based providers, and rate cuts for private providers totaling $1.83 million. White calls the consequences of those cuts devastating.
There are between 700,000 and 900,000 Oklahomans each year who need help. We have enough resources to reach about 195,000 people, so the door's already pretty narrow. 1 out of 3 people get in the door now, which means 2 out of 3 don't. That door just got narrower.
The agency will focus its efforts going forward on those with the most serious mental illnesses, but the budget cuts will be felt in the loss of early intervention and treatment programs.
The further and the longer that you wait to get into treatment with any type of mental health condition, whether it's mild depression, whether it's anxiety disorder, whether it's ADHD, whatever it is, the longer you wait, the more time and more treatment it takes to get back to who you are.
Tracy Cook is executive director for the National Alliance on Mental Illness in Oklahoma City. Cook says if the state doesn't appropriate the money for mental health, the gap won't be filled by the private sector or by nonprofits such as NAMI.
Because everything we provide is free. Education classes, support groups, and advocacy, everything we provide is free. Our phone calls are starting to pick up, and we only have 7 employees statewide. We are mostly volunteer-based, and so it's gonna put a crunch on us as well.
White says the cuts' impact will be felt by the individual, families, and the community as a whole.
When people can't get the help they need, that's when we have to worry about negative consequences. That's when we have people sitting in jails instead of medical facilities getting treatment.
That's evident in Midwest City, where police are seeing the effects of the cuts.
We probably respond to, sometimes it's a little better than 100 mental health calls per month. Sometimes it's a little less, but it averages out to be about 100 mental health calls per month, which averages out to be 3 or 4 per day.
Major Robert Cornelson says state law requires law enforcement to provide transportation to and from mental health facilities when it's determined that someone is a danger to himself or to others. Unfortunately, budget cuts have reduced the amount of bed space available for people needing mental health treatment.
What that means to law enforcement is we find ourselves driving all over the state and occasionally out of state even to get somebody to bed space for treatment.
Providing that transportation comes at a price, and not just in the cost of gasoline.
We always send 2 officers when we do that for everybody's safety. And so you're pulling off 2 officers out of your manpower. That's 2 officers that can't respond to a neighborhood disturbance or another problem in the city. They're gone for sometimes 2.5 hours.
In an effort to reduce the number of mentally ill people who repeatedly find themselves behind bars in Midwest City, the department is partnering with Red Rock Behavioral Health Services for a jail diversion program to provide mental health and substance abuse treatment. That program involves a counselor who works at the municipal jail 40 hours a week.
And what she does is she looks at every single inmate, every single person that's brought into our jail or existing inmates, and if they have a mental health issue or a substance abuse issue, then she looks at getting them into treatment in lieu of staying in jail.
Rihanna Harris is the program coordinator.
I will say it's more of a holistic approach instead of a, kind of put a Band-Aid over, a scar or something. We're trying to say, hey, let's, get this person healthy and address their needs. And so that way we're, hopefully that they will not reoffend.
The program, which could last up to 6 months, offers medical services and therapy to inmates who agree to participate. Harris has been very happy with the results to date.
It has been very effective for the individuals who actually participated. Actually, a little bit over 80% of our participants in the program has not reoffended in Midwest City.
The cost for the program, just over $50,000, is split evenly between the Oklahoma Department of Mental Health and the Midwest City Police Department. Funding is available for at least one more year, but Midwest City Police are hoping additional money will be provided to further expand the program.